Welcome to today's lecture on lung abscess. In this comprehensive script, we will delve into the various aspects of lung abscess, including its introduction, diagnostic modalities, treatment options, complications, atypical presentations, risk factors, prognostic factors, pediatric considerations, radiological features, a multidisciplinary approach to management, emerging treatment strategies, and research updates. We will wrap up this script with some intriguing case studies and problem-solving exercises. So, let's get started. A lung abscess is a localized collection of pus within the lung parenchyma. It is usually caused by bacterial infection, commonly anaerobic organisms. Symptoms include cough, sputum production, fever, chest pain, and weight loss. In summary, diagnosing a lung abscess involves a thorough clinical assessment, followed by imaging studies like chest X-rays and CT scans. Sputum and blood cultures, along with blood tests, further help in identifying the causative organism and assessing disease severity. The treatment options for lung abscess include medical management with appropriate antibiotics, percutaneous drainage, and surgical intervention. Antibiotics should cover common pathogens, and percutaneous drainage allows for drainage and antibiotic administration. Surgical intervention may be necessary in certain cases. Despite appropriate management, lung abscesses can be associated with various complications that impact patient outcomes and management strategies. Common complications include the development of empyema, pus collection within the pleural space, necrotizing pneumonia, bronchopleural fistula formation, abnormal communication between the bronchus and the pleural space, and abscess rupture leading to pneumothorax. These complications often require additional treatment, including thoracentesis or chest tube insertion for empyema, bronchial embolization or surgical repair for bronchopleural fistulas, and surgical interventions for pneumothorax. Diagnosing lung abscess can sometimes be challenging as it can present with atypical symptoms or mimic other conditions. In certain cases, the symptoms may be subtle, making it vital for clinicians to remain vigilant. Conditions that can mimic lung abscess include tuberculosis, fungal infections, pulmonary septic emboli, lung tumors, and other space-occupying lesions. These differentials must be considered and ruled out based on appropriate investigations and clinical judgment. Certain risk factors and predisposing conditions increase the likelihood of developing a lung abscess. These factors include a history of alcoholism, periodontal disease, gastroesophageal reflux disease, GERD, seizure disorders, altered consciousnness, or any condition that impairs cough reflex or predisposes to aspiration. Furthermore, individuals with compromised immune systems, such as those with HIV/AIDS, malignancies, or undergoing immunosuppressive therapy, are at an increased risk of developing lung abscesses. The prognosis of lung abscess depends on various factors, including the underlying cause, the extent of lung involvement, and the promptness of diagnosis and treatment initiation. Timely and appropriate management with antibiotics and interventions, when necessary, often lead to complete resolution and favorable outcomes. However, delayed diagnosis, inadequate treatment, or presence of complications can significantly impact prognosis and lead to adverse outcomes such as treatment failure, recurrent abscesses, or even death. Lung abscesses are relatively rare in children but can occur under specific circumstances. In the pediatric population, lung abscesses are most commonly secondary to aspiration, underlying structural lung abnormalities, or immunodeficiencies. The clinical presentation and management principles are generally similar to adults, although there may be variations in the choice of antibiotics and consideration for the child's age, weight, and associated comorbidities. Close monitoring and follow-up are crucial to ensure complete resolution and prevent recurrences. Radiological imaging plays a fundamental role in the diagnosis and monitoring of lung abscesses. Chest X-rays often depict cavitation, consolidation, and air fluid levels. However, Connecticut scans provide more detailed information about the abscess size, shape, and any associated complications such as empyema, bronchopleural fistula, or necrotizing pneumonia. Radiologists meticulously evaluate the imaging findings to determine the appropriate management approach and guide subsequent interventions or surgical procedures when necessary. The management of lung abscess requires a collaborative and multidisciplinary approach involving various healthcare professionals. A team composed of pulmonologists, infectious disease specialists, interventional radiologists, thoracic surgeons, and respiratory therapists work together to ensure comprehensive care delivery. Close coordination among team members facilitates prompt diagnosis, appropriate treatment planning, and diligent monitoring of patients, ultimately leading to improved outcomes. The field of lung abscess management continues to evolve, with ongoing research and exploration of newer treatment strategies. researchers are investigating the potential use of novel antibiotics, the role of immunomodulatory therapies, and alternative interventions in select cases. Keeping up with the latest research findings and treatment updates is essential for healthcare professionals involved in the management of lung abscess to ensure optimal patient care. To further enhance our understanding, let's now explore a few case studies and engage in problem-solving exercises. These cases will allow us to apply the knowledge gained throughout this script and analyze real-world scenarios related to lung abscess. By critically evaluating these cases, we can refine our diagnostic and management skills. Lung abscess is a serious condition that requires accurate diagnosis and appropriate management. Understanding diagnostic modalities, treatment options, complications, and risk factors is crucial. Collaboration and staying updated enhance patient care. Thank you for joining this comprehensive lecture.